Namaskar. The average per capita personal income in the United States is around $68,531. The median personal income of a family of four, I'm choosing four because that is a typical size, is around $80,631. Now, what is going to happen when a lot of illegals get work permits and they get included in the Affordable Care Act system, which was something that Obama passed, and it's also called as Obamacare. I'm going to show you the impact of numbers of that. But for those who are not going to be captured by Obamacare or ACA, Affordable Care Act, what are the other expenses? So when you sign up for health insurance today, what happens is you have a visit fee. That is, per visit, you have to pay a certain amount of money. Then you have plans like bronze plan, gold plan, silver plan, platinum plan, and so on and so forth. The order is a little bit different than what that is. Essentially, all those things mean how much are you signing up so that you can say, okay, I will take out-of-pocket expense to so much, and then after that, I want the plan to kick in. Because the more out-of-pocket you are willing to take, the less will be your per month insurance premium. This is just a back of the envelope calculation. I'm going to show you all that stuff. So in this, the recently signed executive order by Donald Trump, Make America Healthy Again, or MAHA, has a lot of help for those who don't get under the Obamacare but who are paying for their own insurance. Many small businesses, small families, people who are not covered by corporations for whom they are working. So this is a fairly big number. And for them, what happens is that because of this executive order that has been signed, if you go for any surgery, elective or compulsory, you will get to know how much is going to be your expense before you actually have the surgery performed. Before, it was not like that. You would know only after. So the sticker shock of having survived an operation is more than actually the operation itself for many people. So this is the one that he is covering. But now throw into this mix the fact that there are today 12 million illegals, and perhaps they are going to stay here and get work permit, then they come into the affordable care system. What kind of a havoc that would wreak on the US economy? It is just mind-boggling. I'm going to show you a slide deck and I'm going to walk you through the numbers, and I'm going to tell you how this is being combated practically on a war footing to try and get this $36 trillion deficit down to be able to manage it. This is not something that's going to be easy to do, in my opinion, because the last term, Trump tried to throw off the Obamacare, but he could not succeed, did not have the numbers. I don't think he has the numbers this time either. At least he can get the out-of-pocket expense to be more manageable, which is what he has done. I mean, if you look at the entire health insurance window, that's the one thing that used to be non-negotiable because it would come after your surgery was over. Now you get to know how much it's going to cost you. So it's going to help the person who is going to get that surgery done, surgery or any other thing. It could be even something like a prosthetic fitting. You understand, it's something that is not cheap. Let me put it that way. So I'm just going to walk you through how the Obamacare was designed and who gets how much, what are the benefits of those, and what happens when 12 million people get added into this system, because most likely all of them would qualify in that. So I'm going to show you that, and please like this video because this is something that has come after a fair amount of research. Because I was thinking, why is Trump signing this executive order for people knowing how much they are going to incur before the actual process? It's very important because if you see the entire picture, that's the one thing that you can control. That's in your control. So let's take a quick look at what is going on here. Here we go. Obamacare. Will this go to? Unfortunately, I think not. I don't think Trump has the numbers for that. So let's first understand what is Obamacare. It's also called as Affordable Care Act. Who benefits from it and who will lose the most if it is scrapped? This is not going to get scrapped, in my opinion, because many of the people who are actually under this have voted for Trump. In fact, even middle class or lower middle class Let's say if middle class is split into three parts: lower middle class, middle class, and upper middle class. The middle class and the lower middle class are probably under this today, and it would be a huge financial hardship if this goes away completely. What is exactly this ACA, Affordable Care Act? Now, there are slabs here, and the way to understand is on the left, or the first column is the number of people in the household. One person house, single person taxpayer, 2, 3, 4, 5, 6, and so on and so forth. Then there is a number that you can add for each additional member. Now, if you look at what is the federal poverty level, it is actually, I'm just going to skip, 12,140. So this whole table is defined based on the 12,140, which is the FPL level. That's the number one here, 100%, right? So just remember this at the back of your mind. And if you have a family of 4, which is typical, then if your gross income is around 100,400, there is some confusion here whether it is gross income or taxable income. I believe it is taxable income, but I'm reading that people are saying it is gross income. I doubt it. Usually it is the taxable income. Then if that is the case, if you are making a taxable income of 100,400 or less, then you can qualify for Affordable Care Act. Now, what are the subsidies that people are going to enjoy based on the ACA? If you look at the first column, that is the income. Okay, then if you look at how much money you have to pay, if you are earning less than 23,000 a year, then you are going to have to pay nothing. The annual premium plan is $8,290. If you fall sick and you go to the hospital, you don't have to pay anything out of pocket. Now, bring it up to the last one, 94,200. The maximum percentage of income you have to pay is 9.5, or about 10%. Okay, and the annual premium is 8,290. But look at the subsidy you are getting. You're getting no subsidy at all, which means you have to pay all of that 8,290. This is the big deal here. If you're making less than 23,000, the subsidy is quite high. I think it's almost all of it, which means you don't pay any money. Essentially, you are getting health care for free. But if you come to 94,200, which is the top of this, then you are getting a subsidy of nothing. You have to pay the entire plan of 8,290, and this is silver plan. What silver plan typically means is that 70% of the expense the insurer provides, 30% you have to provide. So even here, the new MAHA order is going to help, because that 30% is actually in your control now, because you get to know which particular plan to prove. For example, let's say you have to get a stent done, right? There are 4 types of stents available. Molybdenum, which is supposed to be the top of the line. Then there is something else, there's something else, there's something else. So you might want to say, okay, I'm 75. I'm probably going to be alive for another 10, 15 years max. I don't mind having a little bit lesser expensive stent instead of molybdenum, right? So then you have a little bit of savings because of that. That's what this executive order gives you. The basic math is 4x the federal poverty level. As long as you are making 4x or less than the federal poverty level, which I told you is 12,140, then this is your expected contribution up to 133%. That is 12. You multiply 12,140 by 1.33. Let's say 20,000, 23,000. That's right. So that is 2.08% of your income. So there is some definition. At the lowest earning member in the United States, they would still have to pay 2% of their income for insurance. But this insurance is all expenses covered. That is the good part. But if you happen to be not falling in this, then what happens? If you are not falling in any of this bracket, that means you are making more than 104,000, and you are living in a city. By the way, the affordable income today, even though the median income is $80,000, the affordable income, much of United States, is $100,000. If you want to have a little bit of comfortable life, you need to have $100,000 a year salary. But if you are living in expensive metropolises, such as Los Angeles, San Francisco, San Jose, New York, or many of the bigger cities, you need at least 200,000 per family to have a comfortable standard of living. 200,000, double of that. So for those people, what happens to out-of-pocket expense? All these formulas just go out the door. They're not applicable anymore. So that is the one problem. So here is where the executive order will help a lot. But go back to the other one that I said. If there are 12 million illegals joining the system under the ACA, think about where the money for treating them is going to come. It's the same hospital. It's the same cost per procedure. So that is going to be coming from those who are making more than the income that is mandated in Affordable Care Act. So that means there's a disproportionate share of money you have to give. So why did the Democrats allow so many people to come in? My simple guess is these people come in, they get full benefits because most likely they will not be able to break out of this Affordable Care Act annual income requirements at least for 10 to 15 years. So they enjoy the best of America at the expense of the more richer people. And therefore, they will be a loyal Democrat voter. This is what they are trying to do. And not only that, they've also selectively placed these people in places so that much of the congressional seats are already spoken for. For example, Ilhan Omar. For example, AOC. They may not be able to win in any other district, but on that district, they are going to win until somebody better than them comes from their own community and challenges them. So this is the challenge there. So these 12 million have to go out or have to be sent out because the system just cannot afford that. So what are the ways to do that? Well, there is one CEO from Blackwater. He has given a proposal. He says, if you want to evict these 12 million people, you need a private company's help, such as ours. We will deport 500,000 every month. For the next 24 months, that comes to 12 million. This is the official number, but we know unofficially it could be more. We will deport them. We will have military places where we can hold these people so that they can be in that pipeline. These people keep leaving. And the total cost for the United States government's exchequer is $25 billion. $25 billion. This does not include, I guess, the cost of catching the illegals and bringing them to one of the facilities that this Blackwater company might have. So this is what they are saying. So far, the Trump government has not responded. The interesting thing here is the Trump government has also said every country from where the illegal came, that country will have to bear his or her expense of deportation. So this is going to be a problem for countries like India. If you leave it to them, the cost of deporting will be much lesser compared to what the US government is going to charge you. So we have to wait and see how this plays out. So it's a very complex mix here. It's not just the fact that many people are in danger of losing their jobs because of the illegals coming in and putting pressure on the wages, but there's also problems about how to support them insurance-wise. And there are other problems, housing, for example, transportation, all these things come into play. Big mess is all I can say, but at least Trump is trying to make a fist of it. He's trying to get some things going. So let's at least appreciate him for that effort part. Thanks for watching. Please like, share, and subscribe to our channel. Don't forget to click on the bell button for notifications. Click all on the bell notifications. Namaskar.